Hi guys! Welcome back to my channel. It's me, Chris, your crazy nurse RN. So for today's video, we will be discussing about the 5P's of purposeful hourly rounding. So as a nursing staff or as a nurse, as an LPN, as an RN, as a CNA, it is very important that you do your patient's rounding. So what we're gonna discuss today is how should we do it properly. So we have 5 guidelines or 5 criteria that we should be checking when we're doing our hourly rounding. First, we will understand what are the benefits of doing a purposeful hourly rounding. So there are actually 5 points that I'm gonna give to you. First is it enhances quality of care. And this will lead to the second benefit of doing an hourly rounding, which is patient satisfaction. So if you give an excellent and safe and quality care to your patient, this will equate to patient satisfaction. And as a healthcare provider, as a nurse, or as a CNA, this is our goal, for our patient to be satisfied of the services that we render to them. And in our case, nursing care. And the third one is it reduces falls. Because you're having your hourly rounding, you go to your patient, you check your patient every hour, and that would reduce the incidence of fall. And the fourth one is it actually increases the nurse's compliance. So if we have a proper criteria, or if we have a proper way of doing our patient rounding or hourly rounding, so this would entail extreme or high compliance from our nursing staff, because they know what they're gonna do. We have policy, we have an established criteria and established ways on how to do it. So as a result, nursing staff or any other staff that is involved in the care of our patient would have an increased compliant, or they will be compliant of doing this kind of procedure. And the fifth one, which is the last one, is that this will give an opportunity for us to actually ask what our patients needs during that time. And that is a very important way on how to assess of our patient. So when you go to the room of your patient, you would ask, do you need anything else? Do you need water? Or if the patient is having difficulty of breathing, you can assess the patient. So that would be beneficial for the patient and for you as well to render safe and quality nursing care. So those are the 5 benefits of patients hourly rounding. And now we will proceed to the 5P's of purposeful hourly rounding. So what are the 5 things that we need to check when we do our rounding or when we check our patient? So the first P that we will be discussing is pain. So the first thing that you're gonna ask your patient is, are you experiencing pain? The characteristics of pain, intensity, the frequency, and all those stuff. You have to ask that. And it's very important because pain is an indicative of sometimes pain is an indicative of an underlying condition. Or because we wanted our patient to feel comfortable, they need some pain pill. Most of our rehabilitation patients are actually in pain because of some sort of surgery, fall, fractures, and all those stuff. So it is very important to ask that. The second P is potty. So you ask the patient, do you want to go to the bathroom? Do you want to pee? Do you want to have a bowel movement? You have to ask those things, especially if your patient is unable to stand or unable to ambulate. So tendencies are sometimes they don't know how to call for help, or probably the call light, was not in the reach, so they'll try to get up, and that would result to fall, and we don't want our patient to fall. So every hour or every time you have a chance, you ask your patient if they need to go to the bathroom, and in that way you'll be able to assist them or to go potty. So the third one is possession. So we make sure that all the patient's possession, like those important things that they need through the night, are within the patient's reach. For example, the call light, it should be within his or her reach. And also the light switch, if you have like a string, sometimes hospitals have string that they have to pull it for them to have some light, so it should be within the reach of the patient. And also other things that you think that that the patient wanted to be within his or her reach, okay? Because the tendency here, if it's not within the reach and they have to get up, there will be a tendency that they will fall, and we don't want them to fall, okay? So we have to make sure that those things are within patient's reach. And the fourth one is position. So we have to assess also our patient's position. Are they comfortable of their position? For example, where the patient couldn't move himself or herself, so we have to reposition the patient based on his or her comfort. So we have to check on that in order for us to know if the patient is comfortable or not, so that we could intervene and change the patient's position. And the last one is personal needs or personal items. So as this is, I think this is kind of related to the possession, but in this way we have to make sure that the personal items and personal needs of your patients are taken care of. So if there's anything the patient needs, like if the patient is hungry, you can give him some snacks, or if the patient wants to talk to a relative because he or she is anxious, we have to accommodate that. And if the patient needs a paper towel or water or something that they wanted at the moment, so you can ask them. It's either personal items or their personal needs. So again, guys, these are the 5 P's that you need to assess and ask your patient when you do your hourly purposeful rounding. So again, the first one is you ask about pain. The second one, you ask about potty. So you ask them if they wanted to go to the bathroom. The third one is possession. So make sure the call lights are within the reach, their important equipments, and some personal things that they wanted to be within the reach, so that they won't, overreach it and would result to an incident of fall. And the fourth one is position. So we have to ask the patient if the patient is comfortable with their position. We have to turn the patient if the patient couldn't move on their own. So we have to assess on that. And the last one is personal items or personal needs. So we have to ask them, do they need something at the moment? Do they need some items for them to use as of the moment? So we have to make sure that these 5 P's are assessed every time we do our patient rounding. So make a system in your patient hourly rounding, especially during night shift when the patients are like sleeping, nobody is in there to help them. So you better do your patient's hourly rounding using these 5 P's that you need to assess and check every time you go to your patient. So I hope this helped you a lot. So again, this is Chris, your Crazy Nurse RN, signing off. Bye.